Can they do anything to prevent it, or what would you counsel this patient on?
Yeah, good question. And that is a good question even more broadly too, as far as, what are all the potential roles and why would we get it and things like that. If you know someone's higher risk, and this is what we tell people who have, like, let's say you come in with Peyronie's disease, we'll say if you feel comfortable talking to your, sons, brothers, things like that, you can pass along this information too. But if you catch it early enough, we do think there's a lot you can do to mitigate it and prevent it from becoming as bad as it would otherwise. There's a good study out of Spain from Martina Salamanca's group where they started someone on traction very early and they caught it,
Okay.
within the first few months, and they ended up not having nearly as severe a disease if they didn't otherwise. There's also some data out of the UK, out of Ralph's group, that basically looks at if you start someone on Viagra in advance, and even potentially something like Clomid or tamoxifen, they're looking at these different drugs. You
Hmm.
can also probably prevent certain cell types from turning into the final plaque that develops with Peyronie's. There's also some data that, to my knowledge, hasn't been published yet, but that shows that if you do ibuprofen, which is an anti-inflammatory, you can cut down on the disease. And that makes good sense to me because when you look at rheumatoid arthritis, ankylosing
Hmm.
spondylitis, lupus, things like that, these DMARDs, or these disease-modifying antirheumatic drugs, are preventing the disease from developing and becoming as bad as it would. So there's every reason to think that would be true with Peyronie's disease as well. So if you knew that you were higher risk and you got the onset of symptoms, you could immediately start on a whole set of treatments that would
Hmm.
probably, we think, would prevent you from becoming as bad as you would.